Here.
Yes. Oh, it works. That's good. All right. Well, thank you, John. As John said, I'm Alyson Hollewijn, and I think Tyler, we need to get the slides up on the screens. Sorry, guys. Okay, great. Here we go. So I'm Alyson Hollewijn. I've been working at Plexis in the corporate wellness program for about a year and a half. I designed, developed, and implemented the wellness program that we have today at Plexis. I was asked to come and speak about corporate wellness and the role with, I think, health plans and the relationship between health plans and corporate wellness programs. And I stared at that subject for a couple weeks and kind of thought to myself, we've been a year and a half in with corporate wellness, and what is our relationship with our health plan? Because there is a relationship there. But we're still so new with corporate wellness that it's still growing and we're still figuring it out. So after talking with our HR manager, a lot of thinking, the gal who works for me, I just came to the conclusion that right now there's a big change going out in the corporate world with what's expected of employers for employees. And I wanted to present to you guys what is happening with the trends of corporate wellness and kind of what's going to be happening in the future, because it's becoming the new necessity for employers. And it's becoming something that in the long run employers are going to have in their best interest to provide corporate wellness. So I want to give you guys the best opportunity to be ahead of the trend and be ready for when corporate wellness really hits the scene. So that's the base of my presentation, is mainly just discussing kind of what's happening, what's going to be changing, and what our plans are, and how we see that being the most effective way to take on wellness. So what you'll see in this presentation, just the basic outline, I'm going to discuss what the base of a successful wellness program is, how you start a wellness program, and that actually ties in very closely with health plans. We'll move into other corporate wellness programs that have been around for some 20 years, some are more current, what they're doing, and a lot of them will kind of hit home to you. I think we have 2 health plans in there that kind of talk about what they've done in their own group as to be a successful wellness program. We'll go into the Plexis wellness program. If you guys haven't figured it out yet, we call ourselves Plexicans, and our CEO calls us Plexican Americans. And so you'll hear the word Plexican a lot in the presentation, and you can start counting how many times I say it if you want, because you'll hear it a lot. And then I'm going to talk about our growing relationship with our health plan. So it's ever-changing, it's always evolving, what bumps we've hit along the way, what we want to see out of each other, and what's going to make the corporate wellness program at Plexis successful by the relationship with our health plan. And then let's go to some closing remarks. If any of you guys have questions, if any of you have experience working with corporate wellness, if any of you come up with revelations on what would be a great tactic for corporate wellness, we'll open that up for discussion. Oops. That's weird. Well, we lost a slide. Okay, so the base of the successful wellness program actually will end up bringing you these results. So when you start up a wellness program, there's 2 different ways to do it. So you look at any wellness program across the board, across the country, and around the world, and none of them are the same. And actually, even our wellness program, we have 2 buildings at Plexis that are less than a mile apart. The corporate wellness program is the same across the board, but the cultures between the buildings are so different that the actual wellness program is almost drastically different between the 2 buildings. But you'll always see the same trends when it comes down to starting a wellness program. And that's what path you take. There's 2 different main paths. One of them is to start out, your HR manager decides they want to start up a wellness program. The executives have realized healthcare costs are rising, the health of the employees is not good, and it's starting to affect productivity, efficiency, all those things. You want to do a wellness program. Well, at open enrollment, you decide that you're going to run a health risk assessment. You've never touched on wellness with your employees before, but in a couple months, you're going to roll out a health risk assessment, which is a basic physical for employees. Employees go in, they find out what their cholesterol levels are, what, maybe their body fat percentage is, how their, blood pressure is, the list goes on. You set a baseline of what you expect as for a healthy employee, and you try to hopefully have your employees hit that baseline. If they hit that baseline, they get a reduction on their premium, their monthly premium on their insurance plan. And actually, I think, is it in 2013, Jeanette, that it's going to go from 20% to 30%? Yes. So with the new healthcare reform, if you run an HRA in your company on open enrollment and you hit that baseline, your employees can get up to a 30% reduction on their monthly premium, which is a substantial amount for employees. It's a lot of money. So you run this HRA, you get the results, you figure out what the baseline is going on with your employees, you realize what's happening underneath the surface. And you're not just seeing a possibly unhealthy employee, but you're realizing you got a lot of health issues going on. You take those issues and you implement a program. You put in yoga, you put in meditation sittings or personal training, and you start developing this program based off of what these results came up with. And on top of that, you're working with your high-risk employees. So employees who don't meet those standards, you put together a health plan for them. You say, in 6 months we want to see you here. At 1 year we want to see you here. Now, if they get to those results, then they get their discount on their premium, and on top of that, they get to feel healthy, and they get all of these great results of stress relief, weight loss, the list goes on. It's a great way to start a wellness program. I would, you'll hear bias in my tone with the next subject because we actually chose to go a different route. The downside to that is that you've never discussed wellness with your employees. So you have employees who their minds aren't ready for it yet. Their bodies aren't ready for it yet. They haven't started opening their minds just to getting healthy. And so they resist it, and you actually run into issues with employees feeling forced, possibly discriminated against, and it can snowball into a lot of different issues. It is an effective way of doing it because it helps you design and implement a program that's going to be successful. You most likely are going to get better executive support because you have hard facts you can show them and give them right away. But you might have issues with your employees. The other route, which is actually the route that Plexis chose, is to implement the culture first. We decided we wanted to make an official wellness program. And for those of you who've been with us for a while, you'll know that Plexis has always had a culture of, as John was saying, we've had game rooms, we've had walking meetings. We've always tried to have a little bit more of a unique culture. When we decided to do an official wellness program, we wanted to enhance that culture. So within the first couple months of the program, we slowly implemented programs. We started to change the culture slowly. We added yoga, we added massage, started opening employees' minds. And through the past year, we've really enhanced our program. And we'll go into much more detail about that soon when we get to the Plexis Wellness Program. But with doing that decision, what happens, maybe after a year or two, whatever it takes, your employees' minds start to open up. They start to want to make the changes. They're actually asking for a health risk assessment because they want to know where they are. And they want to start feeling and seeing the benefits even more. So you have people, you can require an HRA or you can make it an option. And you're most likely going to probably make it an option. And when you make it an option, you're going to have more people take the HRA. And they're going to want to make those changes. You also already have a program rolled out. So when you're giving the analysis back to employees, you're saying, here's where you need to work on. We've got yoga that's going to help with your chronic back pain. We've got meditation sittings, which should help with your stress levels. We have all these programs. They're already here for you. They're already ready, and you can jump into it immediately. There's no 3-month waiting period of implementation of programs. They can jump into it and strike while the iron's hot. And that's where my bias is, obviously. So I have this chart just based off of kind of for employees who participate in wellness programs. Here's kind of the areas where you can really see the success and where you can start seeing some changes. And the one on here that stands out to me a lot is the managed stress levels. And I actually find it very ironic that it's on there because if you do all these things, if you're regularly exercising, you're eating healthy, you stop smoking, your stress levels are going to reduce automatically. That comes with it. That's the point of doing those things. You're learning how to deal with stressors that come at you. All of us have been through experiences where you are so stressed out and you don't know how you're going to make it at the end of the day. Your boss has just said something and you're infuriated, or your wife is calling you, she wants you home, but you have to work, and you've got the stress coming at you. But if you've got these tactics that you're learning through a corporate wellness program, your stress levels, you're going to be able to handle that stress a lot easier. And so that's one main goal of corporate wellness, is to be able to take what the world throws at you, be able to handle that stress, and then in turn you'll be a lot more productive and efficient in your job, and probably even happier when you go home. So that leads us into, oh look, it's swamped. Okay, other corporate wellness programs. So I chose Google and as my first one. For most of you, you guys all probably know that Google has a lot of employee perks. I think that if you do a presentation about corporate wellness, you don't bring in Google, it's almost criminal. Google has chosen to just do peer culture. They wanted to just change and revolutionize the way that the corporate world works. They have napping sites, they've got like on-site pods and beds for employees, they have basketball courts, they have on-site massage, they have on-site medical staff, hair cutting stations, they have oil changing stations, they've got everything there for their employees to be able to really enjoy their workday. They look at their work site as an opportunity to really enhance productivity. So it's not just a place where someone comes, they sit, they do their job, and they leave. But they're also there to open their minds and to be active and to get the best product out. Their employees provide the product, so why not give them a good environment? It's been very successful. It's a great recruiting tactic. When they ask their employees to work 10, 12-hour days, their employees are more than willing to do it most of the times, because if they need to, they can go take a nap if they have to. They have those options. They're less focused on the 8 to 5. They're more focused on, let's get this end result. Get it done at 3 a.m. I don't care. Get it done at 8 a.m. But just get it done. And while you're here, be healthy and be happy. And the employees take advantage of it. They all do. The next one is Merrill Lynch. Merrill Lynch, about 12 years ago, provided cholesterol testing. Their benefit plan had told them they've got some cholesterol issues, and they should probably look at it. It was costing them a lot of money. They brought on an on-site medical staff to do cholesterol testing, and they were shocked by what it came out with. Their results were way worse than they had anticipated. So they put everyone on a 6-month plan who had the bad results, and they started working with them. They told them, and they actually emphasized outside of work doing these things. They would go and exercise, eat healthier. They were put on a plan. Within 6 months, their rates started to reduce. After a year, they dramatically reduced. And they were seeing a lot of change in the cost of their benefits. After about a year, they implemented mammograms, blood pressure, cholesterol, a whole plethora of medical testing. And now, 10 years later, they have a whole medical staff that works full-time on-site at Merrill Lynch. So they took the approach of doing the medical testing right away, putting people on programs, and getting them healthy that way. It's been very successful for them. They have they've gotten a lot of awards for being a very health-conscious company. Their employees' retention has gotten better, and their healthcare costs have dropped dramatically. The next one, actually, we're going to go to Regents before MHS. Regents, I chose, there's a local site here in Medford, and we have a lot of employees who come over from Regents that work at Plexis, and they've been able to kind of give me the inside scoop on what Regents does. Regents really promotes their wellness program. They talk about it, they use it in recruiting, they have a whole website for it. And basically what they have is you run an HRA with your employees at open enrollment. They take the results, they put them into an online portal. That online portal will help keep track keep track of your health goals. So if you don't come out well, you don't do well in your testing, it's going to set goals. Every week it's going to email you and say, you forgot to work out last week, you need to go work out, or you're doing great, you're staying on track. Through time you get little gift cards if you're reaching your goals. And then I think every 6 months, every year, you do another HRA, and if you meet your goal, then you get your discount on your premium. It sounds really great. Some employees really like it. They say they have about a 60% participation rate, but I'm sure plenty of you guys are thinking about how easy it is to cheat on that, right? It's really easy to go and just say, I walked 150 steps, extra steps yesterday, so I deserve a gift card. So a lot of employees were kind of saying that it turned into almost a lot of employees were cheating and they were competing on who could get the most gift cards. So it's a good program, but the other thing actually is there's kind of an old school and a new school form of thought with the Regents program. The new school is, let's get on the health and wellness, let's help take care of our employees, this is a necessity. The old school is, don't do anything during the workday unless it's during your 15-minute breaks or your lunch break before or after work. They have a gym there with showers. It's a nice gym.